Hi, I'm Jo. I have been short-sighted for most of my life, and I think I had my first pair of glasses when I was probably about 12, which I didn't really like at the time. And I started wearing contact lenses since 16, so that's a fair few years now. And when LASIK first came out, I was very scared. People were saying, oh, you should get your eyes done. I was like, oh, no, because there was no evidence to show about how good it was and any side effects. So I carried on with the contact lenses and the glasses. But I'm very sporty. So I used to run, row, I like swimming. And I just found over the years that I suppose your life around when you're going to wear your lenses, when you're going to wear your glasses, and towards the last couple of years, the expense was phenomenal, because then I noticed there was issues with reading. So not only did I have issues with distance, I then had issues with reading, and I had to go down the route of varifocals. So it cost me a lot of money to get a very good pair of varifocals, so the distortion wasn't too bad. Plus I still had the cost of contact lenses. And I think last year I really thought about, researched LASIK again. And I came across Tariq in my substantive position, and I started to research it a little bit more because I was asking him questions, and I decided that I was going to look into Monovision. Monovision would then allow me to be able to read and look in the distant. So I decided to speak to Tariq, and I found out a lot more information and made the decision to consider LASIK. The key factors were cost. So I was coming up to the point where my prescription had changed. I needed to go and get another pair of varifocals, and I was very keen to get one of the most expensive varifocal lenses so that I would not have as much distortion. Plus I would still have the cost of contact lenses. So if I had LASIK at that time, I probably would have recouped that cost in a year and a half with my glasses and my contact lenses. So as I knew Tariq and I knew of his expertise, I felt very comfortable in making that decision from a financial and something that I've kind of always considered. On the day of surgery, I was a little nervous, as I suppose everyone is, but I'm a nurse by background, so those kind of things don't faze me that much, although I never liked eyes, so that's always kind of made me feel a bit. But on the day of surgery, Tariq was phenomenal actually. He explained everything in so much detail, but not only the procedure, what I would expect, so what people would do and what people would say, so I would always know what the next thing was. So I wasn't left thinking, oh, what's going to happen now? And actually during the procedure, he did exactly that. He told me every single thing that was about to happen. Then he told me when it was finished, and then he told me again what was going to happen. So it was a repeat of what he told me before I went into theatre. And that really did have an excellent effect on keeping me calm. And I think the only thing that I would say about the procedure is there was slight discomfort with the pressure, but that lasted 4 or 5 seconds. And I'm absolutely amazed how pain-free and how it was so easy. I think that's the only way I can describe it. Because I had monovision, I noticed seeing in the distance straight away. And in fact, for the first couple of days, when I was getting ready to go to bed, for example, I'd think, oh, I've got to go and take my contact lenses out. But clearly I didn't. But it was very strange that I could see. But I did notice that the reading was a little blurry. And Tariq had made me aware of that because my brain was now having to get used to one eye being done for reading and one prescribed for distance. So that didn't concern me at all because, like he did for the surgery, he gave me advance warning of what would happen. Immediately post-surgery, it was a little bit uncomfortable and like a scratch, a grittiness in the eye. But I followed the instructions that Tariq gave me because he made it clear that he had done his job and now it was my turn to do my job to make sure that the results are what I wanted. So I was very meticulous with the eye drops, very meticulous wearing the sunglasses, not only in light, but when I went outside, even if it was dark, to stop any dust getting into my eyes. And obviously the follow-up appointments also were crucial. And now, after I think I'm 4 weeks post-surgery, I don't have any problems with the reading. I can pick up my phone, I can read something, or I can look at my laptop at work. and then I can look in the distance, and it's like I've never had problems with my vision. And it was funny actually the other day, before going into the lockdown, I was with a friend in a pub garden, and I didn't have to put the menu like this. I could just read the menu and look away, and she was like, "Oh my goodness, you're reading on your distance." I said, "I know, it's phenomenal. It's like it's made me feel a bit younger, should we say?" I absolutely would recommend Oculase and Tariq, and in fact I already have, to a number of people who are considering and looking at maybe doing it in the new year. Why? Firstly, why Tariq? I think choosing a company isn't really where I start. I choose the surgeon. I think it's imperative to choose the surgeon rather than where they're based. And I chose Tariq because from the very word go, he was very clear in his explanations, clear in the way that he would talk in layman's terms, so I understood. Even though I am a nurse myself, I'm not an ophthalmic trained nurse. So when you use the technical jargon, sometimes you don't fully understand. But Tariq was incredibly clear in all the different options that would be available to me, asking me why I wanted it, so he could tell me what he thinks from his clinical expertise that would be good for me, albeit the choice being mine at the end of the day. If I then think of my checks with the optometrist that he works alongside, if I then think about the day of the procedure, and I've also had a follow-up check since the surgery, if I combine all that, Tariq has been so informative, so friendly, so knowledgeable, and very, very patient-focused, and I think that's incredibly important. I don't really understand why I have waited so long. You know, hindsight's a wonderful thing. I can think of many occasions in previous years where actually if I had this done, I probably everything would be more seamless. Even simple things like being on holiday, sunbathing and wanting to take a dip in the pool, deciding in the morning whether or not my activities were going to need contact lenses or whether I should just wear my glasses. But then if I decided to just wear my glasses on holiday, then when I took them off to go in the swimming pool, I couldn't see anything. And also little things when you go out in the day and if the sun comes out and I was wearing my glasses, I couldn't have my sunglasses on because I never liked the prescription sunglasses, and I never liked the glasses whereby they would change the lens according to the light. So it's really simple things that I look back and think, I wouldn't have to worry about any of that. And obviously when I was rowing, that would have been amazing, when I was running and going to the gym. So absolutely there is, but I was never wanting to do it from a fashion point of view. I didn't mind wearing glasses. Some of the glasses that I had, you know, I do think glasses can be quite stylish. But from a reality and just living your everyday life, yes, I do wish I did it before.